Hello, and a very warm welcome from myself, the lead for public and patient involvement in the College of Medicine, Veterinary and Life Sciences at the University of Glasgow. My interest in public and patient involvement started 8 years ago, working in the Primary Care Research Network and seeing how an information leaflet is worded can influence whether patients take part in a study. I also realised there are many aspects of a study that can influence whether a patient decides to take part in the project. This ignited a desire in me to involve patients and the public so that studies are designed to be more real and meaningful for people living with a disease. And this is why the lived experience is central to research and why public and patient involvement is critical to the success of a research team. Today, I would like to talk to you about how public, patients and carers have worked with researchers at the University of Glasgow using the National Institute of Health Research National PPI standards to look at some of the fabulous work from our PPI members. Let's start by looking at some of the public and patient involvement groups based at the University of Glasgow. There are 3 general groups made up of public patients and carer members who meet regularly to advise on all aspects of research, from deciding what questions to ask, to how to ask those questions, and how to interpret and publicise the answers. They are reimbursed for their time and expenses. The idea is that no one should be out of pocket for taking part in a PPI group. Patient and public are also involved in specific projects. Trust and relationships are so important to public and patient involvement. Members of public and patient involvement groups, sometimes known as public contributors, are equal part of the research team. The public contributors for the REACH-HF study were interested in the study interviews and how that data was analysed. Every group is different, and this support can range from research methods to IT skills to analysis of results. Some have statistical skills, some have epidemiological skills, some have clinical skills, but people from PPI groups have lived experience of illness, which only they have and which is an important part of research. The MVLS PPI steering group is a general group that meet up about 4 times a year to give lay advice on grant applications. Usually the group will advise on about 30 to 40 projects a year. Public contributors from the NRS Primary Care Group also meet 4 times a year, and they provide a lay view of research in primary care and general practice. And members of that group can also be PPI buddies for PhD students in general practice and primary care. The MVLS PPIE steering group worked with the organisation Long COVID Scotland to involve people living with long COVID in COVID research. And 2 public contributors, I'm delighted to say, are now co-applicants on a study looking at dietary interventions for people with long COVID. Equality, diversity and inclusion is a very important area of our work. People who are interested in getting involved in research complete an application form to record information about diversity, focusing on people from ethnic minority groups or living in areas of high deprivation. Members of the patient advisory group for the PERFORM study said it was good to see people from underrepresented groups such as they are involved. People from the Poverty Alliance Scotland organisation have become involved in the Primary Care Network PPI group to advise on making research more relevant for people living in high areas of deprivation. The Arcadia Festival gave an opportunity to showcase some of the fantastic involvement from our public contributors in the University of Glasgow. We ran 2 workshops, one about big data and the other about long COVID research. We had an amazing turnout of people for the workshops. Many people were keen to be involved. You can find out more about the workshops on our website. The website also has PPI resources for researchers and the public. It is important for public and patients who have been involved in research to get feedback about their input. And research proposals that have been lay reviewed are tracked to see if they've been funded and how the PPI input has shaped the study. This information is brought together by our team to help plan how best to support public and patients to become involved across different types of studies. Our members have co-produced workshops for postgraduate students, and this is an awesome opportunity for students to learn about public and patient involvement and to discuss their ideas with members of the public. We will co-produce more workshops for researchers, healthcare providers and members of the public. So if you'd like more information about public and patient involvement, please contact me on tracy.ibbotson@glasgow.ac.uk.